Okay, why don't we go ahead and get started with a couple of housekeeping things. So as we get started, I wanted to welcome everyone on behalf of the Louisiana Department of Health and the Autism Society of Greater New Orleans. We're pleased to be here with you, especially given that it's National Immunization Awareness Month. So just a few housekeeping rules to kick off the presentation. This is a reminder that this meeting is being recorded. We will be sending out a copy of the recording as well as a copy of the slides to all attendees after the meeting. This recording is going to go up on the LDH YouTube channel, and that link will be sent out to, I know, to the meeting host and panelists, anyone who attends, and please feel free to share with anyone and everyone. This meeting does have automatic closed captioning, so if you'd like to access that, please go to the bottom of your screen and click the closed captioning tab. And also, please place any questions, thoughts, ideas, reactions you might have in the chat. Any questions that go into chat will be read and answered during the discussion period after the speakers have presented. We're looking forward to hearing what you have to think. So why am I here? My name is Anna Harris, and I am a Vaccine Equity Partnership Coordinator with the Louisiana Department of Health's Immunization Program's Vaccine Equity Initiative. So the Vaccine Equity Initiative works in collaboration with trusted community partners, local health agencies, and the private sector to promote fair and just vaccination awareness, acceptance, and access for groups that experience disparities in immunization and in health outcomes as a result of that. Why do we need vaccine equity? The population health impact of COVID-19 has exposed long-standing inequities that have systemically undermined the physical, social, economic, and emotional health of racial and ethnic minority populations and other population groups that are bearing a disproportionate burden of COVID-19. And equity in immunization reduces the risk of vaccine-preventable diseases among vulnerable communities and individuals who are at highest risk of suffering from those diseases. It also contributes to health equity in general, and it's a powerful tool to reduce poverty, improve school results, future employment, and health overall. So the Vaccine Equity Initiative focuses on using data-driven approaches, sharing culturally responsive outreach, sharing clear and accurate information about the benefits of vaccination, and continually seeking understanding of varied community needs. We are so lucky to be presenting in partnership with the Autism Society of Greater New Orleans today. I wanted to also, while I have a moment to stand on my soapbox, tell you a little bit about a program that is near and dear to my heart. I run the in-home vaccination program. I'm going to put my name and email in the chat if you have any questions about this at all, and I'll also put links on how to find any information you need on this. So the in-home vaccination program brings COVID-19 vaccine to homebound individuals, people with disabilities, their loved ones, and caregivers. It started in April 2021, and so far we've had over 1,800 individuals register for the program. We provide vaccine to all residents of Louisiana, age 6 months and above, who are homebound or have a disability. All qualify and can receive a free COVID-19 vaccination in the home. So we send out a mobile strike team to administer that vaccination, and they are trained to deal with all types of people with all sorts of needs and are responsive to different situations that might make people not comfortable or able to leave the home. If you have any questions at all about this for yourself, your family, your loved ones, anybody else in your life, please call 855-453-0774 or go online. You can register online at ldh.la.gov/in-home shots. And I'm also going to add a link in the comments where you can visit to learn more and download free flyers that you can share with friends and family on social media, pin up to a community board, wherever. So without further ado, I'm happy to introduce our speakers for today's program, which is presented in partnership with the Autism Society of Greater New Orleans. So a little bit about ASGNO. It is a nonprofit organization serving autistic individuals and their families in the Greater New Orleans area. The organization's mission is to create connections, empowering everyone in the autism community with the resources needed to live fully. ASGNO is participating in the Vaccine Education Initiative, which is a grant-funded program through the Autism Society of America dedicated to providing vaccine education and increasing vaccine confidence and access for the autism community. Also here with us today is Claire Tibbetts, who is the Executive Director of the Autism Society of Greater New Orleans. I just saw a wave. She has been working with ASGNO since 2017 and has spearheaded the expansion of their programs over the last 2 years. Claire is the primary caregiver for her autistic brother and believes in ASGNO's vision to create a world where everyone in the autism community is connected to the support they need when they need it. So our two speakers today are going to be Dr. Elizabeth Margolis and Dr. Fei Chen. Elizabeth Margolis, Doctor of Osteopathy, is in the final year of her triple board residency, where she is trained in pediatrics, adult psychiatry, and child and adolescent psychiatry at Tulane University. She is originally from Connecticut and completed college and medical school in Pennsylvania. Her primary interest is working with individuals with intellectual and developmental disabilities, a passion that was first realized in middle school. She's looking forward to sharing her medical knowledge today to help bring awareness to the importance of COVID-19 vaccinations. And Dr. Fei Chen, Doctor of Osteopathy, is an assistant professor of psychiatry and behavioral sciences at Tulane University School of Medicine, where she specializes in child and adolescent psychiatry. One of her specialties is working with children with neurodevelopmental disorders through the Tulane Center for Autism and Related Disorders. And without further ado, I will get off of here and let them take the stage.
Hey everybody, I hope that you can hear us all right. If you can't, just let us know in the chat. But like Anna said, my name is Elizabeth Margolis, and this is Fei Chen. And today we'll be talking to you about autism and COVID-19. I just want to put in a little disclaimer. We know that some of y'all might be families who have a kiddo with autism. You might be an individual with autism. You might be a clinician. So just keep in mind that this PowerPoint is and this presentation is focused on reaching to everybody. And please don't be afraid to ask questions if you feel like some of the information doesn't pertain to you or you want to kind of learn more about it from your lens as opposed to what we might be talking about. But in general, just with the Autism Society, so the mission is to create connections, empowering everyone in the autism community with the resources needed to live fully. And so to start, we're going to talk a little bit about considerations for the autism community specifically when we're talking about vaccines, specifically COVID-19 vaccination. We know that this community has faced barriers to accessing information, understanding information, trusting information, and accessing individualized care. Vaccines in general in the autism community has sparked a lot of questions and emotions and concerns. And part of why we're talking to y'all today is to help break down some of these barriers. We know it can be difficult. Medical protocols are typically designed with neurotypical patients in mind. So it's really easy for individuals with autism, other neurodevelopmental disabilities, really to feel left out of those, which can leave a lot of questions and concerns. And then something else we know is that access to information about COVID-19 is sometimes difficult to get, in the autism community and outside of it. So hopefully we can provide some of that for y'all today. Interestingly, so there, we think about equity and who's having access to the vaccine, who's receiving information about it. I think that program that Anna mentioned is pretty awesome. Being able to get vaccinations in the home, it's things like that improve that equity that we see. And so really, we know that adults with disabilities have lower COVID-19 vaccination coverage based on our studies. and were not necessarily prioritized in the vaccine rollout, even though it might be more important for these individuals to have protection, just when you think about other co-occurring disabilities. And in the chat, Anna has just put some more information in on the in-home vaccination. So questions that we've had the opportunity to listen to and hear from our community include things like, what is the vaccine? How does it work? Is it tested on people with autism? What about other co-occurring conditions like epilepsy? You know, how can I trust that it won't cause other more serious problems? Another really important one is the protection of the vaccine really worth all the trauma it might be to actually get the vaccine? We know that in all children, but especially those with autism, getting vaccinations, getting shots, just medical procedures in general can be really difficult and traumatic. And so that is an important question to ask. And then, you know, maybe you have an adult child and you want them to be able to make their own choice, but you want to help them learn about the vaccine. And so these are some of the questions that we're going to answer today. So if you're a clinician, we hope this information will provide to you as things that you can provide to your patients. And if you're a family member or an individual with autism, I hope that these will answer some of your questions. So what is a vaccine in general? So vaccines prevent diseases that can be dangerous or deadly. They work with your body's natural defenses to safely develop protection from a disease. So what happens is your immune system produces these things called antibodies, and those are what are basically fight diseases or, you know, infections when you get them. And so a vaccine essentially kind of activates this for you, this process, so that then you have those antibodies to fight any infection that you might get related to what you were vaccinated for. And so a big thing is that vaccines prevent disease. They don't cure a disease. And so it can be hard with your patients, with your clients sometimes, because it's hard to explain the significance of something that's not, is treating a problem that's not there yet or might never happen. So how do they work? Like I said, they work by just kind of preparing your body's immune system, teaching it essentially how to fight off an infection. And we know that vaccines save millions of lives a year. Children get vaccines pretty regularly, and it's what has helped prevent a lot of pandemics, endemics, a lot of very serious complications from diseases that, because of vaccines, we don't have to worry about anymore. And so an important question, and one of those key questions that we had, was the vaccine tested on people with autism? And so in the trials that were done, they did include people with disabilities, and that includes autism. And what they found was that vaccines were safe and effective for everyone, regardless of disability status. So if you're a pediatrician, a nurse practitioner, a PA, someone else who's administering vaccines, a nurse, you can confidently tell your patients that in the trials that were done, people with disabilities, with autism were included in these trials, and we know that they were safe. And what about epilepsy or other co-occurring conditions? So we know that people with autism, people with developmental disabilities do have a higher incidence of other medical conditions. And one of the most common ones we see are a seizure disorder called epilepsy. And so part of understanding COVID-19 vaccines is, of course, not just talking to, one area of medicine, but talking to all the different, providers out there. And so we know that our colleagues in neurology, ones who focus on seizure disorders like epilepsy, do agree that the COVID-19 vaccine is safe for people who have seizures. We also know that part of the International League Against Epilepsy, they've shown that the risk from getting COVID is actually higher that any risk that might come from the vaccine. So all those side effects, sequelae that happen from the virus itself, those are much more risky than what could happen with the vaccine. And according to the World Health Organization, from their studies and their data, they see that this idea is same for those with other co-occurring conditions. So, really all, autoimmune, asthma, all those common things that we see in children. And so going back to that another community question, how can I trust that it won't cause other more serious problems? And this goes really back to what we just said. So the benefits outweigh the risks. It's much safer to get the shot than it is from COVID-19. And that's not just like an opinion that Dr. Chen and I have. That's kind of proven data-driven outcome that they've seen in the studies. And of course, like with a lot of vaccines, you shouldn't be vaccinated if you have a history of severe allergic reactions to any of the ingredients in the COVID-19 vaccine. And that is something important to point out. And when we say severe reaction, we're talking about trouble breathing, throat swelling, needing to go to the hospital. Getting a little rash is not going to preclude you from being able to be vaccinated. I do recommend that anybody who's unsure about if they can get a vaccine because of an allergy should defer to your physician, and they might send you to an allergist just to get that tested out so that they know that you can get the vaccine. And you're never wrong to just talk to your doctor if you have these concerns. They're really your front line. And so is the protection of the vaccine really worth the trauma it might take to actually get vaccinated? And really this statistic just kind of hits home that how beneficial the vaccine is. And unvaccinated people we know are 97 times more likely to die from the virus. And this is even higher in autistic populations. And so part of what our job is, and ASGNO and other resources out there are to help either clinicians or families, patients figure out how to support them to be able to get the vaccine. Because I think with everyone working together, that really should be able to be done so that, it isn't as a traumatic experience to the point where you wouldn't find it worthwhile.
I'm gonna switch gears briefly and just continue what we've been discussing. The decision to choose to vaccinate or not vaccinate can be complicated depending on the individual and your circumstances. So we definitely encourage folks to really talk about what these concerns are and understand their risk benefit to taking one of the vaccines. I will generally go over, for the most part, we know that it will help you with the long-term effects of COVID-19. It will help prevent you from getting sick with COVID-19. It can help you from also getting severe symptoms of COVID-19 should you actually get sick with it. And we know it protects you as well as other people around you who may also have their own risk factors that could be significant. So it's not contested that the more people who do get vaccinated, the more it is that everyone can be safer and we can all get back to what is a normal of our lives. And so some of the side effects that Dr. Margolis mentioned of the vaccines are pretty short term. If you do have a little reaction like a rash or a fever, those are pretty brief, a day or two, as compared to some of those, I'm sure you have heard there being those long haul symptoms that can happen we're not really sure if those are going to be permanent. It appears some folks may actually have that, a year or two now from kind of the onset of the original strain back in 2020. Some folks are still very much dealing with those. So those are absolutely benefits that we will have with getting vaccinated. Now, what are some risks to choose to not get vaccinated for your specific reason? We know that the individuals with disabilities are definitely going to be more likely to be admitted to the hospital than someone who does not have a disability. If you were to contract COVID-19, we know that you're actually less likely to be admitted to the ICU after an admissions, and you're actually going to be more likely to die from COVID-19. So those are pretty significant risk factors in terms of kind of understanding the reasons why. I'm sure there's a lot of different layers of complexities there, but like Dr. Margolis already mentioned, individuals with disabilities oftentimes have many comorbidities that put you at higher risk, specifically for COVID-19, such as both medical and mental health risks. We have seen that the pandemic has made it much harder for folks who have disabilities to receive regular health care and the accommodations and supports that they need throughout their day-to-day lives that they may have typically, which again also kind of becomes a greater risk. So while with regards to the vaccination, we know that it's safe, we know that it works and keeps you from the worst case scenarios, and it's free. And like I just learned today, they can come to you in your home and help you get that vaccination completed. So a lot of benefits that we do know for it. So I'm going to walk through a few commonly asked questions that folks might think of when they question, should I get the vaccine? Will this impact me in some negative way? So, will the COVID-19 vaccine change my DNA? We can 100% absolutely say that there's no evidence of the vaccines changing or having any impact on your DNA. Like Dr. Mogulis mentioned, its only job is to trigger your body to recognize the virus, so that when you do come in contact with somebody with COVID-19, your body recognizes it and is able to fight it off for you. Should I get could I get COVID-19 from the vaccine? We also know that you cannot contract COVID from the vaccine. There is no live virus in it, so you're not coming in contact with COVID. You might be coming in contact with, particles or pieces of it, or even a dead version of the virus, depending on which vaccine you're getting around the globe. But none of those will give you COVID-19. So I'm vaccinated. Can I drop all my COVID precautions? Again, no, you are vaccinated, but with the rise of variants that we really don't know how vaccines are going to interact with being around others who may be vulnerable and may not be vaccinated. It really is best practice to continue wearing a mask when you are in public spaces. So is it safe to get the COVID vaccine if you want to have a baby? Absolutely. There's no evidence showing that there's any links to fertility issues for men or women. Now, we do have evidence that says that you are at higher risk should you be a pregnant woman who contracts COVID during your pregnancy, because there's been elevated risk of medical complications, including miscarriages and stillbirths. Is it worth getting the COVID-19 vaccine if I might still get the virus? Absolutely, because again, we're preventing those worst case scenarios. You get in the hospital, you're needing for intensive care in the hospital, as well as death. So should there be any risk of somebody contracting the virus, which is possible if you go about your day and interact with humans in any capacity, it is still a good idea. All right, and I think lastly, were the vaccines developed too quickly to be trusted? That again is a no, because researchers were able to demonstrate the safety profiles for the vaccines. They were able to do so a lot quicker than normal, simply because the whole world dropped everything for a good year to focus all their energy and resources on this, and that's how we kind of got it pushed through so quickly. All right.
So now I'm going to talk a little bit about preparing for the COVID vaccine. So a couple things to know. So we know that Pfizer and Moderna, right now they're giving as 2 shots. They're giving us shots either in the upper arm muscle, and they're 3 to 4 weeks apart. We know that it takes about 2 to 4 weeks for the second shot for the immune system to fully protect in the response. And so this is important to keep in mind. You know, there's countless stories of people who get vaccinated and then, you know, get the virus the next day and say, well, what was the point? But it does take a little time for your body to build up that system. And even after the vaccination, you might be able to get the virus and spread it to others. But it basically is that information for your body to know how to fight it. And as Dr. Chen said, we know that with the vaccine, you're unlikely to get as sick as you would had you not been vaccinated. Side effects of the COVID vaccine. So serious side effects are very rare. The most common ones are minor, and they include tiredness, headache, some pain at the site of injection, muscle or joint pain, chills, nausea, vomiting, or a little bit of fever. It's important to know that just because you might have these side effects, or if you don't, that doesn't have any correlation to if the vaccine worked or if the shot worked. You know, some people get side effects and some people don't. That doesn't really change or indicate any kind of efficacy. And as we said, it takes a few weeks for your body to build up the immunity. And our studies have shown that protection against the virus may decrease over time, and that's why we have the boosters. So that's an additional dose of vaccine given after those first 2 shots to help people stay protected for longer. I'd really compare this vaccine to the flu vaccine. That's something that you get every year. And, you know, with the booster here, it's a similar kind of idea. People who are 5 years old and up can get the booster. And we know that the booster shots increase antibodies by about 10%. So those are those little fighting soldiers that your body makes to combat the virus. And so just on the studies they've done, we know that the booster shot can help increase those antibodies. And like we said, you can get it at 5 months after you get your initial shot. And so these are just some numbers. If you're a clinician, could be helpful to screenshot or jot down. But these are just some opportunities that you can use to help get access to the vaccines. And this is included at the end of the presentation as well, and we're happy to provide this information for y'all after. So preparing for the vaccines. This is kind of getting at that, am I going to cause trauma to my kid if I bring them to get the vaccine? And what we know, especially with our working with young children, is that visual schedules are a very kind of awesome tool that you can use, not just in vaccines, but really, I think in really any situation where a kid might be experiencing something new or anxiety provoking, that they can be really helpful. So just creating a schedule so that your kid knows what's going to happen, how they can prepare, kind of wrap their mind around that they're going to get this vaccine. I think often we're afraid to tell kids about something that they might not like, but that can sometimes provoke more anxiety, as opposed to giving that opportunity to process the information and prepare for it. And so a social story is a great way to do this. And it's kind of basically creating the story of your kids or your patient's experience with getting the vaccine. So integrating things like why they're getting it, what it is, how they're going to get there, and maybe some details that will be part of this story for them, so that they can really integrate that story into their mind and find that comforting and familiar when they go through that experience. And specifically, so preparing to support needle anxiety. This is not just in children with autism and neurodevelopmental disabilities, but we see this pretty commonly in the pediatric population, is this real fear of needles, which isn't totally out of bounds of our imagination. Getting a poke and something hurting, it makes a lot of sense that kids wouldn't want to go and do that again. So tips that can be helpful are kind of similar to the social stories in that, it's important to talk about this fear, these feelings, letting kids know it's okay to be scared, help prepare them for what is about to happen, really getting to the appointment early so they have time to prepare. You want to kind of have a real relaxed environment, kind of model that relaxedness for the kid, both as the clinician, as the parent. Bringing comfort items can be helpful, practicing deep breathing. We do know too with pediatrics and child psychiatry, you really don't want to use force or restrain children. That can actually increase anxiety. Of course, there are like safety concerns and you have to do what you have to do, but just keep in mind that, minimizing that kind of restraint. And then preparing with peer support. So we're not going to watch this video, but just giving kids the opportunity to engage with people who've been in similar situations, right? Like other family members, friends who have also gotten the vaccine, kind of creating that camaraderie and just having more validation that things are going to be okay.
Switching gears a little bit again, to specifically address some concerns that we may be asked to discuss as clinicians or providers. I think it's important to make sure we're able to identify individuals who may have concerns or hesitancy related to getting the vaccine. It's important to make sure we're able to address these concerns by listening and identifying what's going on for this particular individual, and kind of offer ways to respond to their concerns in a helpful way. So vaccine confidence, I think, is a big issue that we've struggled with over the course of the last couple of years, and in part, this is the trust that the population have in the vaccines that are recommended, and the professionals and healthcare workers who administer the vaccines, as well as confidence in the processes that gave us the guidelines and research and policies related to the vaccines. And rightfully so, there's been some confusion that's led to I think a shaky level of confidence in the community for specifically the COVID-19 vaccine. A couple of those concerns and questions we answered a little bit earlier, but I think additional conversations with patients, members is going to continue being very important. This wouldn't just apply to the COVID-19 vaccine, of course, but I think any, particularly working with our autism population and some of the continued concerns in the community about other vaccines as well, and their role in autism, which just to lay to rest, has been well proven in over hundreds of studies around the world that vaccines do not cause autism in any way, shape, or form. So I think it's important for us to probe and understand in a very kind of open way, what are some of the barriers and concerns that families and individuals are coming in with. These may be within communities, within cultures, even perhaps families or friends or stories that you heard. Our goal is to really kind of help provide the best guidance possible to make that educated decision, and kind of change that hesitancy towards more of a confidence. How can we kind of identify, vaccine hesitancy? Of course, if we're hearing individuals with questions about what are the risks, is it really safe, or do we have to, is it very necessary? If we're hearing folks have alarm or reactions to things that they've seen or read or heard, if we're hearing folks speak and share misinformation that they may have been exposed to from other sources and places, these are all cause for concern. I think for us as practitioners and as clinicians to really take a little bit of time to delve into this and hear these concerns and see if we can provide the education or address any misinformation. So what are some ways we can address this within the autism community? If we're hearing any of those signs or questions that indicate hesitancy, ask and inquire about it. Listen to what your patients and their families are sharing. If there's any specific information you can address immediately and provide that evidence or psychoeducation or vaccine education about, definitely take a moment to share those along with resources that you may have, so that folks are getting the most updated information from a valid resource. Give folks some time to think about and research and look into those things that you discussed, because we know that someone doesn't go from thinking and believing that this vaccine will be very harmful to being ready to come in and get it later that afternoon. It's important, I think, for us to continue following up if we're able to identify individuals with concerns, and continue addressing any additional concerns that come up and revisit this in a very open, non-judgmental fashion. Sharing our personal stories or stories from other practitioners or patients can be very helpful. and I think, really tailoring it to your specific patient or client and their family situation, because everyone's going to have some differences in the risk and benefits that they have to think about when faced with the question of do we get the vaccine, or is there a greater risk to doing that than to not. So again, our goal is to switch some of the hesitancy towards vaccination with confidence, and the primary way really is continuing to establish, and build that trust through communication and transparency and openness, and following up with that population who may be rightfully, questioning some of these things. I think some of you might have heard very recently through the news that the CDC is doing a complete overhaul and an internal investigation upon their processes and inner workings, because they felt they could have a more cohesive approach to to their messaging to the public, to the American people, and they were not happy with their communications and in the last couple of years. And so I think again, being just very open and transparent and sharing the information that you have that are from valid resources are going to continue helping us bridge that trust. Also, as healthcare providers, I think empowering ourselves and each other, and in addition to our patients, to be confident in their decisions to get vaccinated and to be able to continue to do so, I think in a very confident way ourselves, is extremely important. I'm going to click on the chat real quick just to make sure it's not. All right. Well, I know we want to make sure to give ourselves a little bit of time for any questions that might come up from our audience. So let's see. I don't know if.
Where do you want to go here?
Yeah, I don't know if I can skip the next couple of. Oh, here's just a little mnemonic for helping remind us how to build some of that confidence and trust in our vaccination programs and process. Validating the individuals and their questions and concerns. I have those too when I first was looking into the research and making my own decisions about when's the right time for me to get the vaccine, or should I get the vaccine, which we have, I think, as healthcare professionals, of course. Affirming our population, continuing to build that rapport and trust, and of course, just continuing to help bridge gaps wherever they may be, even outside of our clinical encounters. Let me try to find our page that has.
Yes, and I don't know if Claire, you wanted to speak a little bit about some of these, some of this accessibility and opportunities for people to reach out to.
Yeah, absolutely. So part of our participation in the Vaccine Education Initiative is we have a lot of access to a variety of tools and supports that can help clinicians improve accessibility. And all of these are freely available. We have an entire guide on making vaccine clinics themselves more inclusive, but the things that are included in that guide can also be helpful for just day-to-day use as well, because there's a lot of suggestions and things that are contained in that guide from the network-wide experience running accessible vaccine clinics. We also have specially designed healthcare symbol communication boards. The one that's linked in this PowerPoint is the English version, but there's also one available in Spanish. And I can be sure that those links are also distributed, just in case you would rather have both or you need one more than the other. We also have some infographics just on really quick side-by-side ways to address specific barriers like sound barriers, visual barriers, ways to make your space more inclusive for these patients who are coming in and are probably hesitant or they've had bad experiences. And so they're trying, but everything's hard, for everyone. We also do have a limited number remaining of physical vaccine accessibility kits, both for providers and individuals. The provider kits include a set of noise canceling headphones. They have some pain reduction items. They have some stickers and some little things like that. And they also have printed copies of the healthcare communication boards in them. And then the individual kits have like some little fidgets, another little of the pain items, and just little things to kind of help make the experience more comfortable. And if you want any of these things, including those physical actual like toolkit bag items, just send an email to me at info@asgno.org, and we will figure out a way to get that information to you or your clinic or wherever.
Thank you, Claire. In our last slide here, I'm going to leave this one up. This has information on minors who can get the COVID-19 vaccine, and then testing sites and different opportunities through Children's and Ochsner that you can go to for testing and for getting the vaccine. And at this time, we do want to open it up to questions. We're mindful that we have about 10 minutes left. So we just wanted to hear from y'all and see if there was anything we can answer.
And I'll also throw in one note. Since this was created, the Novavax vaccine has also been approved through EUA for starting at age 12. So for adolescents age 12 through 17, and then individuals 18 and above. So that's another vaccine option available. But yeah, I don't see any questions in our Q&A or chat yet. Please do drop things in either the Q&A or chat if you can.
Yes, definitely.
And I have some questions anyway too. I think you just answered some of them, Claire, but for the handouts that were shown a little earlier, especially that one for visual, the visual questions to help your kid get a little more comfortable. Is that in one of the links that you shared?
I may not have linked that one, but I can send a link that has like the break off links to all of the collateral. So the visual schedules, the social stories. There's a whole lot of different support materials that are already developed and available. So I can definitely make sure that link is sent with the stuff that you send out.
That's wonderful. So yeah, when we send everyone the recording and the slides, we'll send links to how to download some of those materials as well. I wanted to say thank you to Drs. Margolis and Chen. This was just so impactful. There was a lot of great information here. And I know that even though we had to kind of speed up through some of it, I feel like attendees will really be able to grab some great information off of the slides and the video later. So thank you for that.
Yeah, and we just want to encourage everyone. I know that was a lot of information. Maybe we don't have any questions now. People who will be listening to this as a recording, please feel free to reach out to us if you have questions as a clinician, as a parent, as an individual with autism. We're happy to provide any information we can, any resources that we can.
Wonderful. I do have one probably very simple question for y'all, but I'm interested. So one of the things that we talked about was acclimating the patient to the space where they're going to get vaccinated and giving them enough time to really be calm and go into this. So do you have any advice for setting up a comfortable and calming waiting space, especially if you're going to have individuals with autism coming in as a provider?
You would say.
No, I can. I think really just a place that, probably if you think of like a typical pediatrician's waiting room, a place that has, that's comfortable, that, has toys, just things for the kiddo to do, that isn't too overcrowded, that, where I work in the pediatrician office I work, they do have like a separate area for sick kids and non-sick kids. So I think that's kind of helpful just so that, if like a child coughing a lot, really sick, really uncomfortable, that you're kind of having, one, not spreading all those germs, but also just having a little bit of distance. But yeah, I think it's just kind of all the kind of typical things you would expect: comfortable chairs, hopefully a window, just, those kinds of things.
I think I would just throw in one more thing, to say, make it, I think, child friendly, make it so that there's things that they may be able to kind of distract themselves with or engage with while they're waiting. So it's not a really, it's continue to build on that anxiety of knowing what's kind of coming next. Of course, just kind of keeping in mind some of the potentials for overstimulation, maybe kind of, a little, like Dr. Margolis said, more natural lighting, kind of toning down the artificial, like bright inside lights, maybe having a little corner or area that's a little more, again, sensory friendly, a curtain or something where if a child does need, to take a moment and feel like they're in a little bit of space on themselves, even in something like a big waiting room, they're able to, do so and get a little bit of privacy and maybe take an opportunity to de-escalate. But yeah, beanbag chairs are never a bad idea for kids.
We're adults too.
Yeah, true story. So making it, I think, as fun and calm of, experience leading into something that will be really intense will be helpful. Having the families have their plans with them and being able to walk through it. Like, here we are at step 2, you already did step 1 and this is what's going to be coming next, setting that expectation, right? Those are good things, I think, to kind of do in that moment, help kids kind of continue working through that journey. I don't know if that answered.
Yeah.
I hope that answered the question.
I think that's great information for folks to have and to be considering when they're setting up their waiting spaces. I know that I would love a space like that. So
little music never hurt.
Exactly.
Yeah. Sure.
Well, I'm not seeing any questions come through, so we might be able to call it a day, but this information is going to go out. We will have the video, we'll share with everyone. And thank you so much for taking time to be with us today to answer questions and give us information that's really going to help some lives.
Oh, thank you for
our pleasure.
having us.
Yes, thank you.
Wonderful. Well, thanks so much and have a great day, all.